Now, ladies and gentlemen, thank you very much for coming. My name is Warren Namara. I'm the director of the Health Monitoring Unit of Statehouse. We thought we would bring you up to speed because there was a flurry of tweets in the social media, a lot of communication in the social media about the executive director of Mulago, Dr. Byarugaba Baterana, having been detained yesterday by the Health Monitoring Unit. First of all, that is correct. We requested him to come to the HMU to interact with us on issues that I will unpack a little down. And we are delighted to say that he is cooperating. He is, we are still engaging with him in order to understand further if you I will only restate that the executive director of Mulago, who is also the accounting officer, is with our criminal investigative department with us since yesterday. And as I was saying, we continue to work with him in order to understand a few things that I'll unpack a little bit further. 1 year ago, that's April, almost 1 year ago in April last year, we started trying to understand how Mulago offers services, how Mulago functions, and how Mulago meets the expectations of the public. In other words, we were looking at the management of Mulago in the fullness of its meaning. And that included finances, human resource management, procurement, drugs, etc., etc. You will be familiar that that's our work as the Health Monitoring Unit of Statehouse. Monitor and see where the delivery services meet the expectations of government, meet the expectations of the people. Now, in the course of our work, there are preliminary findings that we have got. And actually, that's why we needed the executive director to help us understand what we were seeing. Now, I'll start with the finances. We interacted with 65 members of staff from Mulago, 65. And we recorded statements, and we established that about 974 million was unaccounted for or misappropriated or otherwise unexplainably expended. In the process, the accounting officer failed to notify the accountant general about missing vouchers totaling to about 5 billion. We have this, so you'll get it. You'll get the figures if they confuse a bit of it. That is on finances, but a little bit more will come. Now, on equipment and equipment repairs and maintenance, which involves autoclave, central sterilizing department, and etc., etc. In 2016, Mulago contracted 2 companies, Cetramaco International and Conventional World, for a wide range of services that you'll finally see in what we have given you. Now, our investigation about those companies have so far revealed, based on forged job cards forged job cards, work completion certificates, duplicated activities. These two companies were paid by Mulago 20 billion shillings, 20 billion plus shillings. That's an amount that is not small, and it's really lost to government. That's based on duplicated work and all sorts of terrible things. Now, let's go to the procurement of medicines and medical supplies, because that's a big chunk in Mulago. Our team verified supplies allegedly supplied from a private pharmacy, and I'll talk about a private pharmacy later. The private pharmacy is called the first pharmacy. The verifications were prompted upon establishing from the IFMS system. You know what the IFMS system, all of you, payment statements obtained from the accountant general, indicating that during the period under investigation, Mulago had paid more than 1 billion shillings for medicines procured and supplied under emergency orders, presumably after running out of NMS supplied stocks. But when we looked at it further, these were our findings. There is a burns unit, the unit for burns in the different places. And we verified that the burns unit, which is located in Chirudu Hospital, that time it was still under Mulago Hospital, established that only a small quantity of purported deliveries made by the first pharmacy had been received. A very small quantity purportedly supplied by the first pharmacy was received. Most of other delivery notes from first pharmacy indicating deliveries have been made to the burns unit have since been denied by Kirudu Hospital. In other words, there were a number of delivery notes that were not generally acceptable by Kirudu, which was the consumer unit. Now, further to drugs, the Mulago bulk or central store receives drugs. Now, during the verifications, it was established that funds worth 754 million, that's plus 754 million plus, were paid to first pharmacy on an account. 14 different transactions between December 17 and 20 for untraceable supplies. In other words, 2017, 2019, 14 times 754 million, we could not trace what that money was for. Where the stores signed acknowledging receipt on the said deliveries and goods received notes generated, there is absolutely no record that the said items were entered into the respective stock cards and issued out to different departmental users. There's no trace at all. The investigative team also took note of the fact that most of the items indicated on the first pharmacy delivery notes as having been supplied to the bulk stores were the same items as what National Medical Stores delivers to the hospital and dispenses to the public at no cost. So you might wonder, if NMS supplied these stocks, why did first pharmacy sell, or why did Mulago buy? So a total of 40 million was paid to Mulago first pharmacy purportedly for purchase of medical supplies. Analysis of these documents so far reveal that the said medical supplies were not delivered to the hospital. Once again, gentlemen, these are preliminary findings. Now let me talk about the operations of the first pharmacy, the private pharmacy. Mulago management entered into 2 memoranda of understandings between 2 pharmacies, the first pharmacy and the eco pharmacy. This was in 2018. It entered into those memoranda for 10 years. On scrutiny, on further analysis, the MOUs and the tenancy agreements between the 2 pharmacies were poorly conceived, poorly executed in our view, and without due diligence and clearance from the relevant government departments. The accounting officer of a public institution which is not autonomous has got a certain level of operation beyond which he can't commit government. The pharmacies are currently operating illegally without National Drug Authority licenses. So they are illegally existing. Due to these poorly executed memoranda of understanding and tenancy agreements, both the eco pharmacy and the first pharmacy have defaulted on paying rent equivalent to 135 million on one of them and 67 million plus on another. This is 67,500 and 135 plus, so I'm not going into all that. I wonder, in our view, we think private pharmacies should not exist in public hospitals because you will never have the public get the drugs that we supply from the national medical stores. I usually use an analogy of farms. If you have 100 cows and you bring me with my 20 cows, your 100 cows will never have a calf. They will never increase. Mine will increase, but yours will never. It's a mixture of bad things. So, in conclusion, ladies and gentlemen, the total unaccounted misappropriated funds at Mulago Referral Hospital during the period under investigation is so far 28 billion plus. I want to emphasize that these findings are preliminary. We shall continue to unpack them. We shall continue to engage the relevant officers, senior officers in Mulago to further understand the expenditures, the accounting or lack of it, and the management of human resources. So I thought we would give you this so that you understand further and know that this is an ongoing exercise. Yes, we are still engaged with him. We are discussing with him. He's our colleague, he's a professional colleague. So we continue to engage with him, well knowing the rights of an individual under the Constitution. First of all, he was not arrested in a manner that has been talked about by some social media. We invited the executive director a month ago to come and interact with us. He replied through his lawyers that he was unwell, number one, and that we needed to give him time because what we were asking him to provide was a lot and he needed time to prepare. Sure enough, we allowed him time to prepare. He suggested a day to come and waited for that day. He did not come. Neither did his lawyers come. I called him several times and he told me he was going to consult his lawyers and get back to me. He did not get back to me, and he did not call, neither did his legal representation appear. So we said maybe he was having challenges and difficulty in coming. So we went and assisted him to come to the HMU for further discussions. And sure enough, we provided transport and he came with us. The current holding charges, and they could be changed, they could also be amended. One is fraudulent or false accounting of government funds, abuse of office, embezzlement, and causing financial loss to government. There were a barrage of complaints about Mulago, a lot of complaints, and we thought we should respond as part of our mandate, because our mandate is partly to respond to public demands, public complaints, public requirements. And that's what took us to Mulago. It was a routine, but on reaction of the different complaints on top of complaints about the management in Mulago, or perhaps lack of it. Imagine the management of Mulago is as like managing a ministry. So we have talked to many people. I've told you, right, that we interviewed 65 staff, senior staff. We also made a presentation to the senior staff and the management when we discovered a few things and gave them time to respond. But we also have interviewed or recorded statements from the senior hospital administrator, the senior hospital engineer, heads of account, senior accountant, and accounts assistant. First of all, we'll take them to court as soon as investigations are complete. That's number one. But we shall respect the provisions of the Constitution. That's one. People who are talking about infighting, I don't know what infighting it is, because I don't work for Mulago. BB and his staff don't work for HMU. It's far too small anyway for them to work there. Oh, if they are talking about the Minister of Health and Mulago, I'm not aware of the infighting, and I'm not even able to comment on it. But we don't work for individuals. We are not controlled by individual interests. Somebody telling us to fight somebody's wars. No. That's not what we are. We are as civil and as professional as they come. So if there is any fighting between the Minister of Health and Mulago, which I don't know, I think it's not arrest. The police arrests and does the investigation and records a statement. Our job is the professional part, but we don't arrest, we don't detain, and we don't try. So we work with police, Uganda Police, we work with the judiciary, we work with the Ministry of Finance, we work with different government entities and ministries and departments in order for us to do our job. So we did not arrest, neither are we detaining him. But the police is the one that is recording statements from him, and they are recording the statements from him at our offices because we have a CID section. And after that, the police will process him as is expected of the constitutional rights. Your other question was on the other people whom we arrested. We are still recording statements, by the way, but those ones are on bond. The police gave them a bond, and they are reporting to police. We are doing investigations, and as soon as we have investigations complete, we shall arraign them in a court of law. There is no doubt about it. We don't arrest, we don't detain. The police does. Okay, first of all, we are not working independently. And the word independently, I don't know in what context. But we are working with the police, which is a constituted department of government, in its fullness capable of regulating itself and determining the need for support from any other departmental area of government. So we are not working independently, whatever you mean by independent. So number two, we are not, you know, it's very interesting, and I thought I had answered this question from Nelson. We are a duly constituted unit of Statehouse. Under the Constitution, you can check. We have our own description, we have our own identity. We don't fight people's wars. And I clearly said we are professional and civil. We don't fight people's wars. If people have got wars, let them fight them. At least we know the ones, we choose the ones we fight for ourselves. So when you talk about Diana, the PS, and Mulago, or BB in this case, I am afraid that is speculation. But of course, you know, being a very good journalist that or journalistic paper monitor is, you can always interview Diana and you can always interview BB. But I want to assure you